161. A patient with iron deficiency anemia is prescribed parenteral iron. What should the nurse monitor during administration? A. Allergic reactions. B. Blood glucose levels. C. Respiratory rate. D. Skin turgor. Answer: A. Allergic reactions. Rationale: parenteral iron can cause allergic reactions, including anaphylaxis, so monitoring for these, A, is critical. Blood glucose, B, respiratory rate, C, and skin turgor, D, are not primary concerns during administration. 162. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which lab result is most concerning? A. D-dimer elevation. B. Normal hemoglobin. C. Normal platelet count. D. Decreased INR. Answer: A. D-dimer elevation. Rationale: elevated D-dimer, A, indicates fibrin breakdown, a key feature of DIC, and is concerning. Normal hemoglobin, B, and platelet count, C, are inconsistent with DIC. Decreased INR, D, is not typical as INR is usually prolonged. 163. A patient with sickle cell anemia reports fever and joint pain. What is the nurse's priority action? A. Administer antipyretics. B. Assess for infection. C. Apply a heating pad. D. Restrict fluid intake. Answer: B. Assess for infection. Rationale: fever and joint pain in sickle cell anemia suggest infection, a serious complication, so assessing for infection, B, is the priority. Antipyretics, A, treat symptoms. Heating pads, C, are contraindicated. Fluid restriction, D, is inappropriate. 164. A nurse is teaching a patient with hemophilia about self-care. Which instruction is most important? A. Report unusual bleeding. B. Increase dietary sodium. C. Avoid low-impact exercise. D. Restrict fluid intake. Answer: A. Report unusual bleeding. Rationale: prompt reporting of unusual bleeding, A, is critical in hemophilia to prevent complications. Sodium intake, B, and fluid restriction, D, are unrelated. Low-impact exercise, C, is safe and encouraged. 165. A patient with multiple myeloma reports fatigue. What should the nurse assess first? A. Hemoglobin level. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer: A. Hemoglobin level. Rationale: fatigue in multiple myeloma is often due to anemia, so assessing hemoglobin level, A, is the first step. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to fatigue in this context. 166. A nurse is caring for a patient receiving a blood transfusion. Which action prevents complications? A. Infuse slowly over 2 to 4 hours. B. Mix with dextrose solution. C. Administer without a filter. D. Infuse rapidly within 1 hour. Answer: A. Infuse slowly over 2 to 4 hours. Rationale: infusing blood over 2 to 4 hours, A, prevents fluid overload and transfusion reactions. Dextrose, B, causes hemolysis. A filter, C, is required. Rapid infusion, D, risks complications. 167. A patient with iron deficiency anemia reports shortness of breath. What is the nurse's priority action? A. Administer supplemental oxygen. B. Encourage vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer: A. Administer supplemental oxygen. Rationale: shortness of breath in iron deficiency anemia indicates hypoxia, so administering supplemental oxygen, A, is the priority. Vigorous exercise, B, is unsafe. Iron restriction, C, worsens anemia. Warm compresses, D, are irrelevant. 168. A nurse is caring for a patient with a history of pulmonary embolism. Which lab test monitors therapy? A. APTT. B. INR. C. Hemoglobin. D. Platelet count. Answer: B. INR. Rationale: INR, B, monitors warfarin therapy, commonly used for pulmonary embolism. APTT. A. Monitors heparin. Hemoglobin C and platelet count D are not specific to anticoagulant therapy. 169. A patient with sickle cell disease is prescribed pain medication. What should the nurse monitor? A. Respiratory depression. B. Blood glucose levels. C. Skin turgor. D. Joint mobility. Answer. A. Respiratory depression. Rationale. Pain medications, e.g., opioids, in sickle cell disease can cause respiratory depression. A serious side effect requiring monitoring. Blood glucose, B. Skin turgor, C. And joint mobility, D. are not primary concerns with pain medication. 170. A nurse is assessing a patient with suspected von Willebrand disease. Which lab test confirms the diagnosis? A. Von Willebrand factor assay. B. Complete blood count. C. Prothrombin time. D. Blood glucose. Answer. A. Von Willebrand factor assay. Rationale. A von Willebrand factor assay, A, confirms von Willebrand disease by measuring factor levels. Complete blood count, B, is nonspecific. Prothrombin time, C, assesses clotting but not von Willebrand factor. Blood glucose, D, is unrelated. 171. A patient with chronic lymphocytic leukemia reports a sore throat. What is the nurse's priority action? A. Administer analgesics. B. Assess for infection. C. Encourage fluid restriction. D. Apply a warm compress. Answer. B. Assess for infection. Rationale. A sore throat in chronic lymphocytic leukemia suggests infection due to immunosuppression, so assessing for infection, B, is the priority. Analgesics, A, and warm compresses, D, treat symptoms. Fluid restriction, C, is inappropriate. 172. A nurse is caring for a patient with a platelet count of 15,000/mm superscript 3. Which symptom requires immediate attention? A. Petechiae. B. Mild fatigue. C. Dry skin. D. Increased appetite. Answer. A. Petechiae. Rationale. Petechiae, A, indicate active bleeding in severe thrombocytopenia, 15,000/mm superscript 3, requiring immediate attention. Fatigue, B, dry skin, C, and increased appetite, D, are not urgent or specific. 173. A patient with pernicious anemia is prescribed vitamin B12 injections. What should the nurse teach about administration? A. Rotate injection sites. B. Take orally with meals. C. Discontinue after 1 week. D. Avoid vitamin C. Answer. A. Rotate injection sites. Rationale. Rotating injection sites, A, prevents tissue damage from repeated vitamin B12 injections. Oral administration, B, is ineffective in pernicious anemia. Discontinuing after 1 week, C, is incorrect as therapy is lifelong. Vitamin C, D, does not interfere. 174. A nurse is caring for a patient with a history of blood transfusions. Which medication prevents iron overload? A. Deferoxamine. B. Epoetin alpha. C. Folic acid. D. Vitamin B12. Answer. A. Deferoxamine. Rationale. Deferoxamine, A, is a chelating agent that removes excess iron, preventing iron overload from transfusions. Epoetin alpha, B, stimulates red blood cells. Folic acid, C, and vitamin B12, D, treat anemias, but not iron overload. 175. A patient with multiple myeloma reports nausea. What should the nurse assess first? A. Serum calcium levels. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer. A. Serum calcium levels. Rationale. Nausea in multiple myeloma may indicate hypercalcemia, A, from bone destruction, a common complication. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not directly related to nausea in this context. 176. A nurse is caring for a patient receiving a blood transfusion. Which lab result indicates a hemolytic reaction? A. elevated bilirubin. B. Decreased hemoglobin. C. Normal platelet count. D. Normal white blood cell count. Answer: A. Elevated bilirubin. Rationale: elevated bilirubin, A, indicates red blood cell destruction, a sign of a hemolytic transfusion reaction. Decreased hemoglobin, B, may occur, but is less specific. Normal platelet count, C, and white blood cell count, D, are not indicative of hemolysis. 177. A patient with iron deficiency anemia reports fatigue. What is the nurse's best action? A. Encourage rest periods. B. Promote vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer: A. Encourage rest periods. Rationale: fatigue in iron deficiency anemia results from reduced oxygen delivery, so encouraging rest periods, A, conserves energy. Vigorous exercise, B, is unsafe. Iron restriction, C, worsens anemia. Warm compresses, D, are irrelevant. 178. A nurse is caring for a patient with a history of pulmonary embolism. Which activities should the patient avoid? A. Prolonged sitting. B. Low-impact exercise. C. Deep breathing. D. Balanced diet. Answer: A. Prolonged sitting. Rationale: prolonged sitting, A, increases venous stasis, raising the risk of recurrent pulmonary embolism. Low-impact exercise, B, deep breathing, C, and a balanced diet, D, are safe and beneficial. 179. A patient with sickle cell anemia is prescribed oxygen therapy. What should the nurse monitor? A. Oxygen saturation. B. Blood glucose. C. Skin turgor. D. Joint mobility. Answer: A. Oxygen saturation. Rationale: oxygen therapy in sickle cell anemia aims to improve oxygenation, so monitoring oxygen saturation, A, assesses effectiveness. Blood glucose, B, skin turgor, C, and joint mobility, D, are not directly related to oxygen therapy. 180. A nurse is assessing a patient with suspected hemophilia. Which family history findings supports the diagnosis? A. Bleeding disorders in males. B. Hypertension in siblings. C. Diabetes in parents. D. Asthma in relatives. Answer: A. Bleeding disorders in males. Rationale: hemophilia is an X-linked disorder primarily affecting males, so a family history of bleeding disorders in males, A, supports the diagnosis. Hypertension, B, diabetes, C, and asthma, D, are unrelated to hemophilia. 181. A patient with sickle cell anemia reports severe back pain. What is the nurse's priority action? A. Apply a heating pad. B. Administer prescribed analgesics. C. Encourage spinal flexion exercises. D. Restrict fluid intake. Answer: B. Administer prescribed analgesics. Rationale: severe back pain in sickle cell anemia likely indicates vaso-occlusion, requiring analgesics, B, as the priority for pain management. Heating pads, A, are contraindicated as they may worsen vaso-occlusion. Spinal flexion exercises, C, could exacerbate pain. Fluid restriction, D, is inappropriate as hydration is essential. 182. A nurse is monitoring a patient receiving heparin. Which symptom indicates a potential overdose? A. Hematuria. B. Weight gain. C. Fever. D. Dry skin. Answer: A. Hematuria. Rationale: hematuria, A, is a sign of bleeding, indicating a potential heparin overdose due to excessive anticoagulation. Weight gain, B, fever, C, and dry skin, D, are not directly related to heparin overdose. 183. A patient with leukemia is prescribed filgrastim. What is the purpose of this medication? A. Increase white blood cell count. B. Reduce bone pain. C. Prevent bleeding. D. Enhance red blood cell production. Answer: A. Increase white blood cell count. Rationale: filgrastim, A, stimulates neutrophil production, increasing white blood cell count to reduce infection risk in leukemia patients. It does not reduce bone pain, B, prevent bleeding, C, or enhance red blood cells, D. 184. A nurse is caring for a patient receiving a blood transfusion. Which action should be taken if a transfusion reaction is suspected? A. Continue the transfusion. B. Stop the transfusion immediately. C. Increase the infusion rate. D. Administer a diuretic. Answer: B. Stop the transfusion immediately. Rationale: stopping the transfusion immediately, B, is critical if a reaction is suspected to prevent further complications. Continuing, A, or increasing the rate, C, worsens the reaction. Diuretics, D, are not indicated for transfusion reactions. 185. A patient with iron deficiency anemia reports dark stools. What should the nurse explain? A. This is a normal side effect of iron supplements. B. This indicates gastrointestinal bleeding. C. This is a sign of infection. D. This requires immediate discontinuation of iron. Answer: A. This is a normal side effect of iron supplements. Rationale: dark stools, A, are a common, benign side effect of iron supplements due to unabsorbed iron. Gastrointestinal bleeding, B, would require further assessment. Infection, C, is unrelated. Discontinuation, D, is unnecessary without other symptoms. 186. A patient with hemophilia A reports a nosebleed. What is the nurse's first action? A. Apply ice to the nose. B. Administer factor VIII. C. Encourage vigorous nose blowing. D. Restrict fluid intake. Answer: B. Administer factor VIII. Rationale: a nosebleed in hemophilia A requires factor VIII, B, to correct the clotting deficiency and stop bleeding. Ice, A, is helpful but secondary. Vigorous nose blowing, C, worsens bleeding. Fluid restriction, D, is irrelevant. 187. A nurse is caring for a patient with a platelet count of 10,000/mm superscript 3. Which intervention is most important? A. Implement bleeding precautions. B. Encourage contact sports. C. Apply warm compresses to bruises. D. Allow vigorous oral hygiene. Answer: A. Implement bleeding precautions. Rationale: a platelet count of 10,000/mm superscript 3 indicates severe thrombocytopenia, requiring bleeding precautions, A, e.g., soft toothbrush, electric razor, to prevent hemorrhage. Contact sports, B, and vigorous oral hygiene, D, increase bleeding risk. Warm compresses, C, worsen bruising. 188. A patient with pernicious anemia reports chest pain. What should the nurse assess first? A. Oxygen saturation. B. Blood glucose. C. Skin turgor. D. Joint mobility. Answer: A. Oxygen saturation. Rationale: chest pain in pernicious anemia may indicate hypoxia due to severe anemia, so assessing oxygen saturation, A, is the priority. Blood glucose, B, skin turgor, C, and joint mobility, D, are not directly related to chest pain in this context. 189. A nurse is teaching a patient with sickle cell disease about infection prevention. Which instruction is most important? A. Maintain up-to-date vaccinations. B. Avoid low-impact exercise. C. Restrict dietary protein. D. Use heating pads for pain. Answer: A. Maintain up-to-date vaccinations. Rationale: vaccinations, A, prevent infections, a major risk in sickle cell disease due to splenic dysfunction. Low-impact exercise, B, is safe. Protein restriction, C, is unnecessary. Heating pads, D, are contraindicated. 190. A patient with multiple myeloma is prescribed zoledronic acid. What should the nurse monitor? A. Serum calcium levels. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer: A. Serum calcium levels. Rationale: zoledronic acid treats hypercalcemia in multiple myeloma, so monitoring serum calcium levels, A, assesses effectiveness. Blood glucose, B, respiratory rate, C, and skin integrity, D, are not primary concerns with this medication. 191. A nurse is caring for a patient with a history of deep vein thrombosis, DVT. Which instruction promotes prevention? A. Elevate legs when sitting. B. Restrict fluid intake. C. Apply warm compresses to legs. D. Encourage prolonged bed rest. Answer. A. Elevate legs when sitting. Rationale. Elevating legs, A. Promotes venous return, reducing DVT risk. Fluid restriction, B. Is inappropriate. Warm compresses, C. May increase swelling. Prolonged bed rest, D. Increases stasis and clot risk. 192. A patient with thalassemia major reports joint pain. What should the nurse suspect? A. Iron overload. B. Osteoarthritis. C. Infection. D. Vaso-occlusion. Answer. A. Iron overload. Rationale. Joint pain in thalassemia major is often due to iron overload, A. From frequent transfusions, causing tissue damage. Osteoarthritis, B. And infection, C. Are less likely. Vaso-occlusion, D. Is specific to sickle cell disease. 193. A nurse is assessing a patient with suspected disseminated intravascular coagulation, DIC. Which physical finding is most concerning? A. Prolonged bleeding from 4 sites. B. Blood pressure 130/85 mmHg. C. Heart rate 80 bpm. D. Respiratory rate 16 breaths/min. Answer. A. Prolonged bleeding from 4 sites. Rationale. Prolonged bleeding from 4 sites, A. Indicates active bleeding in DIC, a critical finding requiring intervention. Blood pressure, B. Heart rate, C. And respiratory rate, D. Are normal and not specific to DIC. 194. A patient with chronic lymphocytic leukemia is prescribed fludarabine. What is the nurse's priority teaching? A. Monitor for signs of infection. B. Maintain a low-calcium diet. C. Avoid deep breathing exercises. D. Increase sun exposure. Answer. A. Monitor for signs of infection. Rationale. Fludarabine causes immunosuppression, increasing infection risk, so monitoring for infection signs, A. Is critical. Low-calcium diet, B. Is not indicated. Deep breathing, C. Prevents complications. Sun exposure, D. Increases skin damage risk. 195. A nurse is preparing a patient for a bone marrow biopsy. Which instruction ensures safety? A. Obtain informed consent. B. Encourage vigorous activity pre-procedure. C. Restrict fluid intake. D. Apply a warm compress to the site. Answer. A. Obtain informed consent. Rationale. Informed consent, A. Is required for a bone marrow biopsy to ensure the patient understands risks and benefits. Vigorous activity, B. Is inappropriate. Fluid restriction, C. Is unnecessary. Warm compresses, D. Are not indicated. 196. A patient with iron deficiency anemia reports tachycardia. What is the nurse's first action? A. Assess oxygen saturation. B. Encourage vigorous exercise. C. Restrict dietary iron. D. Apply a warm compress. Answer. A. Assess oxygen saturation. Rationale. Tachycardia in iron deficiency anemia may indicate hypoxia, so assessing oxygen saturation, A. Is the priority. Vigorous exercise, B. Is unsafe. Iron restriction, C. Worsens anemia. Warm compresses, D. Are irrelevant. 197. A nurse is caring for a patient with a history of heparin therapy. Which lab result indicates a risk of bleeding? A. APTT of 90 seconds. B. INR of 1.0. C. Hemoglobin of 12G/DL. D. Platelet count of 200,000/mm superscript 3. Answer. A. APTT of 90 seconds. Rationale. An APTT of 90 seconds, A. Is excessively prolonged, indicating a high bleeding risk with heparin. INR, B. Monitors warfarin. Hemoglobin, C. And platelet count, D. Are normal and not specific to heparin overdose. 198. A patient with sickle cell disease reports vision changes. What should the nurse suspect? A. Retinal vaso-occlusion. B. Cataracts. C. Glaucoma. D. Conjunctivitis. Answer: A. Retinal vaso-occlusion. Rationale: vision changes in sickle cell disease are likely due to retinal vaso-occlusion, A. a complication from sickle-shaped cells obstructing blood flow. Cataracts, B. Glaucoma, C. and conjunctivitis, D. are less likely without specific risk factors. 199. A nurse is teaching a patient with hemophilia about medication safety. Which medication is safe for pain relief? A. Acetaminophen. B. Ibuprofen. C. Aspirin. D. Naproxen. Answer: A. Acetaminophen. Rationale: acetaminophen, A. is safe for pain relief in hemophilia as it does not affect bleeding. Ibuprofen, B. Aspirin, C. and naproxen, D. inhibit platelet function, increasing bleeding risk. 200. A patient with multiple myeloma reports weakness. What should the nurse assess first? A. Serum calcium levels. B. Blood glucose. C. Respiratory rate. D. Skin integrity. Answer: A. Serum calcium levels. Rationale: weakness in multiple myeloma may indicate hypercalcemia, A. from bone destruction, a common complication. Blood glucose, B. Respiratory rate, C. and skin integrity, D. are not directly related to weakness in this context.